And welcome to X-ray Review. In this video we're going to go through the modified frontal APOM cervicothoracic view and why you should never take this view. So if you have never seen this view before, that's a good thing. If this is something that you've come across, it's likely very frustrating because you can't see either the cervical spine or thoracic spine very well. Many doctors take this for postural analysis, but what is lost is the ability to exclude pathology and assess the bones. So if we look at the cervical spine, there's a number of structures that we're used to seeing that we can't see anymore, such as the occiput overlapping the C2 odontoid process as well as C1, and then the mandible overlapping the mid-cervical spine. So there are a number of structures that we can't see, whereas on a normal frontal view of the cervical spine, you can see the uncinate articulations very well, the soft tissues and the lateral aspect of the neck. And then on the APOM view, the dens, periodontoid spaces, and then all the anatomy of C1 and C2. But on this modified view, all these structures are really obscured, and that's a very common thing to see. Imagine trying to rule out osseous pathology of the cervical spine and having this as your frontal view. The overlapping teeth, mandible, occiput really obscures assessment of the cervical spine. So while it may look good from a postural perspective, being able to see that scoliosis in the thoracic spine, it gives no information about the cervical spine. On this view, nothing is really seen well. The upper cervical spine isn't factored appropriately, nor is the thoracic spine. So only the lower cervical spine is really visualized well. Here is another example of a cervicothoracic view where you really can't evaluate the cervical spine or thoracic spine well. Remember, this is a frontal view of the cervical spine, and the cervical spine is not seen due to technical and positional factors, which renders this film non-diagnostic. And this is a pretty standard example of this modified cervicothoracic APOM view, and you just can't really see anything very well. In this view, the combination of poor technical factors and positioning limit assessment of the cervical spine. In this view, even though the cervicothoracic region looks okay, the upper cervical spine is completely obscured by the mandible and overlapping occiput. And what I tend to find is you can either see the upper cervical spine well or the lower cervical spine, but you can almost never see both well. And here the mid to lower cervical spine is really obscured, and then technical factors completely limit assessment of the thoracic spine. This patient actually has numerous osseous congenital anomalies. Not that you would ever know it given this image. And while I do hate this view, probably more than any other, this is a good example of one that's taken well on a high quality X-ray machine, and the image actually looks really clear and you can interpret most of it. So it is possible, but by far and away the majority of these x-rays that I see are absolute garbage. And if you really want to image the cervical spine, take dedicated cervical spine images. It's the best way to rule out osseous pathology. So thanks for listening, and hopefully you enjoyed learning about the modified frontal APOM cervicothoracic view and why not to take it. And remember, if you want to image the cervical spine or thoracic spine, take dedicated images of those regions. And thank you. If you enjoyed this, don't forget to like and subscribe. Thanks again.